In April of 2009, the authorities announced the outbreak of a new influenza virus, H1N1.
Just as it sounds, this is an influenza virus that is commonly seen in pigs. However, in rare occurrences, the virus does cause infections in humans. Swine influenza infections typically look clinically much like seasonal influenza, having symptoms such as fever, cough, sore throat, and muscle aches. Sometimes additional symptoms such as diarrhea or red eyes are also present. Typically,
right from the start, the media hype suggested this disease was extremely dangerous and deadly. Even though it usually takes a year to develop a vaccine and test its safety, the American people were assured that development of a vaccine would be fast-tracked, and a vaccine for H1N1 influenza would be available by fall. Then the government got involved with the vaccine program.
The Obama administration is considering implementing a new fall vaccination program against the flu, a plan that would require Americans to get not one, not two, but 3 flu shots. Dr. Nancy Snyderman is NBC's chief medical editor. Nancy, good morning.
Hi, Meredith.
Unprecedented this is. How would this work?
For the new H1N1 swine flu, for which there's no known immunity in our population, that requires 2 shots.
I would think, because it's hard to get people to take the original.
As we know,
shot,
don't we? Since you don't get your flu shot in the fall.
No, I don't. Okay, fine.
Okay.
I might this year, though.
Good.
But now you're asking people to get 3. That's a tough sell.
Well, Meredith, I think you've hit the nail on the head. This is going to be a public relations, trust your government and your health officials public campaign. So I think what the government is likely going to do is urge people to early on get their normal flu shot and then trust the scientists to say the swine flu is for real, get these other 2.
But we trusted the scientists back in 1976 with the original swine flu shot, and a lot of people
got sick. And it was a debacle.
Right.
Not only that, some people died, some people were paralyzed.
From the shot itself.
And people remember the swine flu vaccine as a terrible disaster.
History remembers quite a number of vaccines as a terrible disaster. Yet advertising and propaganda appeared all over America, urging people to get vaccinated. Throughout the summer, the government and media continued to hype H1N1 as the next black plague.
In April and May, we've seen more than 1,000 deaths from pandemic influenza and more than 20,000 hospitalizations in this country.
As soon as the vaccine had been produced in October, H1N1 became a national emergency.
President Obama declared a national H1N1 emergency, an ominous-sounding name for what officials insist is a purely preemptive move.
The president now declaring the H1N1 outbreak a national emergency. The White House says the president signed this proclamation last night. It will allow medical officials to bypass certain federal requirements.
Let's hear that again.
It will allow medical officials to bypass certain federal requirements.
What requirements? By making H1N1 a national emergency, it allowed the vaccine manufacturers to bypass testing for not only safety, but also the efficacy of the vaccination. This is part of the BioShield Act, signed into law by President George W. Bush in 2004. Making H1N1 a national emergency also exempted the drug companies from any liability from any adverse effect of the vaccination. The U.S. government ordered 600 million H1N1 vaccines, enough to give every American 2 shots. Once the vaccines arrived, the media hype intensified.
People started lining up at 7 this morning, and mid-morning, health officials were on track to run out of the initial 500 doses the county had.
But just in time, a new shipment came in, this one for 3,400 doses. It's our top story tonight at 5. Friday morning, the line for an H1N1 vaccine roped around 3 flights of stairs and extended back and forth through the lobby of the Carew Medical Park.
People are already flooding healthcare facilities, anxious to get their H1N1 vaccines.
The brainwashed masses lined up, just as they were told. None of these people did any of their own research into the H1N1 flu, or the safety of the vaccine they were lining up for. These are the government's favorite citizens. These people in Parkersburg, West Virginia, stood out in the rain and waited in a line almost a mile long. All over America, flu shot clinics popped up in schools, shopping malls, churches, pharmacies, and grocery stores. From coast to coast, Americans stood in line for hours, in some places even days.
Parents, as they filled out paperwork and were staged into different areas.
Staged into different areas? What is this, a flu shot clinic or a disaster zone? While trusting Americans went out and got their shots just like their government told them, their government wasn't so sure they were going to be vaccinated themselves. But after a few weeks, the lines were gone and the shot clinics were nearly empty. Only a small percentage of the citizenry had been vaccinated, and they had a lot more vaccines to sell. So they turned to media physicians like Dr. Sanjay Gupta and Dr. Mehmet Oz to persuade the rest of the population to get vaccinated.
If all of us in the healthcare field, and we know what the risks are, we're immunizing ourselves, please let that influence you a little bit.
All right, good advice.
That strategy didn't work too well, especially as news got out that these media docs had stakes in the vaccine companies. The Council on Foreign Relations had another idea.
I think what would work better would be to say that there was a shortage and people tend to line up more for something that's in demand. We saw that there was one season where really people lined up all night to get a flu shot. And
Well, the H1N1 vaccine shortage is causing some major problems across the country right now. Now, this vaccine shortage is especially...
The CFR strategy worked, and more people lined up for H1N1 shots.
I think what would work better would be to say that there was a shortage and people tend to line up more for something that's in demand.
Doctors were promised bonuses. The more flu shots they gave, the more money they made. And they screwed up here and there, but the profits started rolling in for the vaccine manufacturers and their investors. Then the bad news started to come out.
New tonight, a Northern Virginia family dealing with a stunning turn of events. Their healthy, athletic son suddenly comes down with a debilitating illness. They believe it's connected to a swine flu vaccine he got 24 hours earlier, investigating the possible side effect.
It's a huge step back. I never thought I would be using a walker at 14, just less than a week ago, I was high flying playing basketball.
Thursday afternoon, he got his flu shots. By 10 o'clock Friday morning, he had chills and started feeling weak. And by 4 that afternoon, he was having spasms.
A bus driver noticed that Jordan was twitching. His torso was moving all over the place.
At the hospital, his family says doctors made a preliminary diagnosis.
They said he was showing signs of the Guillain-Barré syndrome.
A disease characterized by muscle weakness and sometimes paralysis.
A shocking side effect to a routine vaccination.
Just started a flu shot.
You heard her right. A regular flu shot gone horribly wrong. Tonight, the warning this woman wants everyone to hear.
Her life changed forever on August the 23rd when she says she got a seasonal flu shot at a local grocery store.
I was training for a half marathon and it all went so fast.
10 days after receiving the shot, she came down with the flu. After that, her health spiraled downwards. She started passing out and had to be hospitalized twice.
Yeah, we went to an urgent care facility and they wouldn't even let her get out of my truck because she was seizing in the back, so they called an ambulance immediately.
Doctors at Fairfax Inova and Johns Hopkins diagnosed her with a rare neurological disorder called dystonia. They think it was caused by a severe reaction to the flu shot. She now has difficulty speaking, walking, even eating. During our interview, she had several seizures. The effects are irreversible.
The media still promoted the flu shot, even as Pharmacy Magazine reported mass H1N1 immunization was inappropriate. As the reports of side effects and deaths began to pour in, some people made desperate attempts to warn the population against taking the H1N1 shot.